Thank you. In the interest of time, we're going to take questions later in the interest of time. So we're going to get to the move. We want to thank Rabbi Katz for coming. Really want to give him a hand for being here. We're going to start with the last half of the Rambam's life. We're going to talk about the plain people, the physicians, but really not so plain. We have a panel really of true experts here, and it's really nice for them to spend their time to come here with us, and really appreciate that. First, we're going to start with Dr. Charlotte Glicksman. Dr. Glicksman is an attending cardiologist, pediatric cardiologist, intensivist at Sinai Hospital, who has a wonderful reputation throughout the city, throughout the country, and also happens to be a wonderful neighbor. Charlotte's going to talk about respiratory disease. Charlotte, come on. Thank you.
Okay, I'm a little too short for this. Thank you, Dr. Insel, for inviting me to speak. My talk is sort of geared more towards people with very young children, but a lot of you may be babysitting grandchildren, so that's great. Yeah, can everybody hear me? Okay. So it's now November, although it didn't feel like November yesterday, and it felt a little bit cooler today, but this is starting to get into my busy season. You know, accountants have their busy season in April. I have my busy season now. And the reason it's the busy season for pediatric ICU doctors is because of respiratory viruses. And this is the season for respiratory viruses. So what I wanted to do is just give you a little bit of background about what respiratory viruses do to children and what kind of things you need to worry about and when do you need to go to the doctor. Again, I don't think this is a huge audience with very little children, but yeah, grandchildren, great-grandchildren, whatever. So what are the respiratory viruses that we see? There's a bunch of respiratory viruses that we can test for, and there's probably hundreds more that we don't yet test for. The number of tests that become available just keeps increasing and increasing. So now the two that we worry about the most during the season are RSV, which is respiratory syncytial virus, which is a virus that in healthy older children and adults causes a really bad cold, but in little babies it causes a disease called bronchiolitis. Now, bronchiolitis can look a lot like asthma. Has anybody here seen a kid with asthma trying to breathe? So bronchiolitis looks a lot like asthma, but you can't call somebody with their first respiratory illness asthma because asthma is a chronic disease. It recurs. It keeps coming back. So the disease, and it's also a little bit different mechanism. So why do babies with respiratory viruses get so sick? So think about an airway. Think about the caliber of an airway and airflow through it. So if you take an adult airway, which I'm not drawn to scale, but this is an adult airway. If you have a millimeter of swelling on the inside of the airway, so the passageway for air goes from this to this. Okay, not such a big deal. Take a pediatric airway that starts out like this, and you have a millimeter of swelling inside the airway, you can almost completely or even completely obliterate the passage for air. Okay? That's why children get into trouble with viruses that don't make adults much sicker than a bad cold. So the viruses that we worry about are RSV, respiratory syncytial virus, influenza, parainfluenza. There's another virus that looks just like RSV, and when I was a resident many years ago, we said RSV negative bronchiolitis because we would test for RSV and it would come back negative, and they looked for all the world like RSV, and there's another virus that does exactly the same thing called human metapneumovirus. Last summer, late summer to early fall, we had an epidemic of a new respiratory virus called it was a specific variant of an enterovirus, which usually causes a GI bug, usually causes a stomach virus, but this caused horrible respiratory disease. So there's a lot around, and this is my bad season. Okay, so how do kids with respiratory disease, what do they look like? Okay, so a kid with if you've seen kids with asthma, or if you haven't, if you've seen kids with bronchiolitis, they're working hard to breathe. Okay, they may be breathing faster than normal. And what's a normal respiratory rate? Well, that's very age dependent. So adults breathe 15 to 20 times a minute. Newborns can breathe up to 60 times a minute. Little babies, 2 to 3 months old, maybe 20 to 30 times a minute. So we can have babies who are breathing much faster than that, breathing in the 40s, breathing in the 50s, or even the 60s. They may be retracting, which means when they're trying to breathe, they suck in either between the ribs or in the belly or, here, like that. Babies who are having trouble breathing may head bob. They may, with each breath, their head is bobbing. Babies who are having trouble breathing usually can't eat. They can't nurse. They can't take a bottle because they're using all their energy to breathe. And those are all signs that you might need to bring the baby into the doctor. So those are signs that the baby might be getting into trouble. And then the other thing that you see with respiratory diseases is noise. Okay, or you don't see it, you hear it. But so the two main noises that you can hear are called, one is stridor, which is another respiratory disease, which is croup, which is a noise with inspiration. So you hear like that when the baby breathes in, okay? And bronchiolitis and asthma causes wheezing, which is usually when the baby is exhaling, and it's more like, okay? So, if you're calling your doctor, those are things to pay attention to so that you know what to tell them. Is the noise when they're breathing in? Is the noise when they're breathing out? So those are respiratory issues that you can see. So when do you need to take your baby to the doctor? If they can't eat, if they're working hard to breathe, if you see retractions, if they're breathing very fast, or if they're making a lot of noise when they're breathing. Making noise is good during the day, but you don't want them making noise at night because then you won't be able to sleep. So that's really pretty much all I was going to say. There are a couple other things. Just any baby under 3 months old with any kind of illness, you should always call the doctor just to make sure that they don't need to be seen. And most pediatricians will say under 3 months old they should come in. Any baby with a fever under 3 months old should come in. And then the other thing that you should know about is another respiratory disease that's really much, much, much less common now because of vaccinations, which is called epiglottitis. There's the vaccine for the Haemophilus influenza bacteria has not completely eliminated this disease, but it's far less common than it used to be, where the epiglottis, which is on top of the airway, gets swollen, and it can be a rapid, complete obstruction of the airway. And what do you look for to see that? That's a kid who has a high fever, looks really sick, is sitting forward to try to keep their airway open, and is drooling because the epiglottis is so swollen that they can't swallow. Usually happens in older kids than croup. Croup is usually toddlers and older infants. Bronchiolitis is usually babies from newborn to 6-8 months. Croup is usually 6 months to 2 years, and epiglottitis is usually older kids, but we don't really see it much anymore. But if you do see it, it's really an emergency. What else did I want to talk about? And I didn't really talk much about croup, but croup is usually a virus that in an older person would cause laryngitis. It would make you hoarse. It would make you cough maybe a little bit, but mostly being hoarse. But again, because the airway, this is now instead of the airway obstruction in the lungs, this is the airway obstruction in the throat, at the upper part of the airway, at the vocal cords and just below the vocal cords, where in an adult it'll get a little swollen, it'll get a little smaller, but there's no trouble moving air. In a little baby, it closes down enough that they make that high-pitched noise. So that's really all I wanted to say. And be aware that viruses are around. They eventually get better. There's no treatment for them. There are a few viruses for which there are antiviral drugs, but most respiratory viruses, you just kind of have to support the patient until their body clears the virus.